right, welcome everyone. My name is Chris Wilson. I'm a physical therapist and one of the co-founders of the American Palliative Rehab Alliance, and also the president of the Academy of Oncologic Physical Therapy of the APTA. So thank you for joining the first of hopefully many of these group events. We're really kind of pushing interdisciplinary care in palliative and end-of-life care, and we're honored to be a part of it. So with this event, again, you can have your camera on, you can have your camera off. We are going to be asking people, if you have a question during the event, you can type it in the chat. And then if it's not answered during the session, then we can kind of go through and ask those questions. Or afterward at the end, if you want to raise your hand and ask your questions, or even just tell an important or meaningful story. If things get dynamic, we may run past 8 o'clock, but we totally understand. And this is Eastern time, of course. So if you're on the Pacific Coast, time's a little bit different. But if we run past our time, you're certainly welcome to stay on. But we understand that if you do have to leave, that's okay. And we will have the recording, which we will be distributing. So I'm going to introduce our first of our co-hosts here, and that is Dr. Lori Boatwright. She is the chair of the Hospice and Palliative Care Special Interest Group of the Oncology Academy of the APTA. So go ahead, Lori.
Welcome, everyone. It's been a nice opportunity to collaborate. Again, interdisciplinary is the theme here, and so I'm just delighted that we're able to bring this information to you tonight on behalf of the leadership team. I didn't do a lot of the behind the scenes planning for this event, but I look forward to participating and helping to bring great content to this group in the future. So thank you. Good evening.
Great, thanks. Noreen, I think you're next, and then Anne will kick us off.
Yes. So I am Noreen Carlson, the co-chair of the AOTA Continuum of Palliative Care Practice that I started with Anne Henshaw. We are so excited to be doing an interdisciplinary presentation. I don't think this is done very often, and I hope that we do much, much more of this. And I welcome all the familiar faces that I am seeing on the screen right now. And I will now pass this on to Anne.
Thank you so much, Noreen. And also just an FYI for the OTs out there, our community of practice meets the last Monday of the month and at 7 p.m. Eastern, and we welcome people to join us anytime. I'd also just like to mention that Chris and I started the American Palliative Rehabilitation Alliance, and we offer groups as well. So we would love you to just take a look at Pal Rehab, which is our website, and just sort of work together. If I've learned anything in my many years as an OT, it's that if we are going to make care better, care delivery better, it's going to be through interprofessional care. We can't do it in silos. So I think we can all nod our heads to that. We know that, but it's really hard to operationalize. So with that, and with the 3 organizations, we are so excited to offer you a beautiful person today. Becky is honestly one of my new best friends, and she is just an incredible person with such a love for the profession of occupational therapy, for our patients and clients, and really a specialty in serving our seriously ill clients in a way that is really holistic and thinking about things in really whatever way will help them. She is an author. She is an alumna of Boston University, which is my undergrad. I don't know if you knew that, Becky. And she is here to share. I am putting her slides in the chat. If you don't have them, maybe Chris or Noreen, you can tell me if that's working. If you don't have them, let me know. We will also be recording and distributing the slides. And with that, thank you so much, Becky, for being here and sharing with us.
Oh my gosh, it is such a pleasure. And thank you all for being here. Thank you, Anne, Noreen, Chris, everybody who has helped put this on. And for those of you that are here, let me get started. I'm so thrilled to do this. Thank you so very much. All right, let's get started.
And I just love the accent.
It's definitely Boston, that's for sure.
I grew up there too.
All right, so can everybody see that okay? Okay, great. I'm going to try very hard to, it is a Boston accent, very hard to stick with a 30-minute PowerPoint presentation. So if you can keep your questions until the end, that would be great. And so hopefully we're going to have about 30 minutes of me sharing the use of Reiki with OT and PT in palliative care, hospice, and end-of-life care. And so again, thank you so very much. The way I plan to do this is I wanted to give a very brief overview of Reiki for those of you that may not be overly familiar with Reiki. Then I wanted to talk about the medical support for using Reiki and complementary modalities. Then going into some techniques that all of us can use, OT, PT, anybody involved in APRA, which is a cool alliance. I'm so excited for that. Techniques for palliative care, hospice, and end of life, and then go into some resources. So with that, let me get started. And thank you. We do have the handout of the PowerPoint as well. You'll see my email on the bottom. I do respond well to emails, and it's just my name, Becky at Austill-Clausen.com, and my website as well. So what is Reiki? It's natural energy healing. It's been approved by AOTA, APTA, nursing, etc., for use for dozens of years within our profession. We can do Reiki in person, online, and long distance. And this quote about Reiki is from Penelope Quest, and she's a marvelous Reiki master from the United Kingdom. And I just want to read it so that we just get a baseline for what we're talking about. Reiki is a safe, gentle, non-intrusive, hands-on or hands-off healing technique for use on ourselves or with others, which uses spiritual energy to treat physical ailments without using pressure, manipulation, or massage. Oops, sorry. Reiki uses energy. And so you think, okay, what is energy? Everything in the universe is composed of energy, whether it be X-rays, sound, light, music, nature. What Reiki does is it raises the vibrational energy. Reiki is also spiritual. It's not religious. And there's this cool new term these days that is a medical term called SBNR, spiritual but not religious. And so what it means is that when you use Reiki, you acknowledge that there is something broader than the physicality that we all live in. You can call it anything you want, whether it's God, Allah, Buddha, the divine, the universe, whatever you want, but there is something beyond our physical existence. Reiki is also known as universal love, which I love that. I mean, you can't go wrong with love. And so I wanted to give you a quote from Carol Davis, physical therapist, and this is from her fourth book her fourth edition of integrative rehabilitation. And what she says is when we listen solely from our rational left brains and our hearts are not in the listening, people feel like they're being treated like problems, like depersonalized sources of information. So Reiki uses heart, which is really awesome. When you're documenting about Reiki, the word these days, and it's really been the word for the last like 5 years to use, is biofield energy. Reiki is a biofield energy modality. And so what's that mean? We have energy within us. Many of us know the words chakras, C-H-A-K-R-A. So chakras are energy centers within us, and we also have energy centers around us, which are our auras. And so these are energy fields, a biofield modality that exists within us and around us. And so you think, okay, well, let's bring some practicality into this. If you say you want to have an EKG, I'm going to go have an EKG, or one of my clients is having an EKG or an ECG. What's that? It measures the beat of our heart. And so what it's measuring is energy. We don't call it that. We say, hey, we're going to go get an EKG. What's an EEG? An electroencephalogram. It's measuring the brain waves. It's measuring the brain waves. It's measuring the energy of the brain. What's an MRI? A magnetic resonance image. Say we can't figure out what's the matter with my arm. What is the matter? So I might go have a MRI, or our clients might go have an MRI. They're looking at the health or the disease or the compatibility of our tissue. or non-compatibility. All that's energy, heart, brain compatibility of our tissue. So we're using energy, we just don't usually call it that. Reiki integrates the mind, the body, the soul, emotions, cognition, physicality, spirituality. We use it in treatments and healing and training, the divine flow of universal energy. Currently, there are over 90% of the medical schools in the United States are offering courses in complementary medicine, which is unbelievably more than we only had in 2017, just 7 years ago. 50.8% were offering courses in complementary modality and complementary medicine. So we've seen a huge surge in awareness and recognition for using Reiki and other complementary modalities within our medical fields, within our OT, PT, speech, nursing practice. In 2014, the National Institutes of Health changed the word alternative health. They changed the word alternative health, alternative modalities to complementary modalities. And if you're not familiar with this website, it's a great website. So the National Institutes of Health has now, since 2014, the National Center for Complementary and Integrative Health, meaning alternative is its own thing. If you say somebody, hey, I'm doing alternative health, that means you're only doing that. You're not including it within the integrative component of OT and PT or nursing or whatever. Alternative is a standalone service. Complementary means it complements traditional allopathic care, and that's what we do now. We're using complementary modalities in an integrative fashion, because complementary health works. And so in green is the National Center for Complementary and Integrative Health website in the National Institutes of Health.gov. It's good. It's a good website. In January 1st of 2018, the Joint Commission, which most of you I'm sure know is considered essentially the gold standards of care in hospitals. The Joint Commission made a mandate because of the opioid epidemic that effective January 1st, 2018, all hospitals that are Joint Commission accredited must have a non-pharmacological option for pain. And this is taken directly from this mandate, which is still current. And they used for examples, not mandates, but for examples, acupuncture, chiropractic services, massage, physical therapy, osteopathic manipulation, relaxation therapy, that's Reiki, and cognitive behavioral therapy. Now, it was either 2022 or 2023, the Joint Commission said they made an update to this. And what they said is that it's up to each hospital to determine what type or types of complementary modalities they wanted to use. Doesn't mean they have to use one or the other. It's up to each individual hospital. But to this day, there still needs to be a non-pharmacological option for pain. And this is an excellent validation and rationale for us to use complementary modalities, particularly Reiki, in the hospital setting. So if you're ever trying to get a rationale for using it, this is it. And this is the reference on the bottom. It's on page 2. And if you are sort of trying to figure this out and just want to Google it, the search term is Joint Commission Pain Mandate. So you can just Google Joint Commission Pain Mandate, and that should come up. And then it's EP2 on the second page. It's really quite exciting to see that. One of the problems with Reiki, and I've been doing Reiki, since 1996. So I've been doing Reiki for 28 years, and it works. Reiki works, but we did not have good research until 2018. There's what's called a large-scale affiliated study. One session of Reiki was done with 1,411 individuals. Now, in order to make this standardized, it was all done by Reiki masters, 99 Reiki masters, trained by William Rand, and he was one of the 3 authors of this. And this is affiliated with Harvard. And so Dr. Nair was affiliated with Harvard, and she's the lead author on this. So you had 99 Reiki masters all across the country, all trained the same way by William Rand, the Institute. He does the International Center for Reiki Training. With one session of Reiki, statistically significant reduction was seen in pain, anxiety, tiredness, shortness of breath, depression, and nausea. With just one session, statistically significant increase in overall well-being was also seen. And that was a study that I've been waiting for years for. And so you can get this. It's very accessible. If you go large scale Reiki study DIER, DYER, or you may even get it just with large scale Reiki study. You know, it's interesting with Reiki, we as therapists and medical practitioners are used to helping people heal. That's what we do. With Reiki, it's not us that decides who's going to heal, it's the clients. And so the clients are the ones that are the healing practitioners for themselves. It's a different type of mindset. And so what we do when we're using Reiki is we're using intention, spiritual connection, again, whatever you want, God, Allah, Buddha, divine, universe, whatever works, spiritual connection, hand placements, because with Reiki, you can place your hands very gently on a person, or you can beam it, just like I'm showing. You can beam the energy, or you can do it long distance. The people do not have to be there, or it can be done online. And with mindful breath control, and that mindful breath control is really done by us. So when we're using Reiki with OTPT and the folks involved in APRA, we always ask the client's permission. We are not deciding this person needs to be healed. It's the client that decides they need to be healed. And again, that's a different mindset. And so when you're asking the client's permission, if you do it in person, you just ask, is it all right if I provide you with Reiki? What's Reiki? Well, it uses your own energy to help you heal. And hopefully you're going to get a yes. If you get a no, there's no need to debate, because that client is responsible for healing themselves. The next step is you ask for the client's highest good to be received. And so you calm yourself as the practitioner, you calm yourself, and with mindful intention, you ask whoever it is you believe in or they believe in or whatever, somebody higher than the physicality. You ask for the client's highest good. That's the word. It's not healing. I'm not asking for the client to be healed, particularly with palliative care and hospice, because that, the healing might not necessarily be appropriate or work. You ask for their highest good. We always want to be culturally sensitive. And so you always want to be aware of what a person's culture is and who they believe or what they feel. It's their right. It's their body. It's their life. The difference with Reiki in other complementary modalities is Reiki uses what's called an attunement process. Miko Yasui was the person that started the Yasui form of Reiki, which is pretty much the classic form of Reiki being used by millions and millions of people these days. He received 3 healing symbols. And what happens with Reiki is these healing symbols are placed in your aura and they're placed in your body. They're placed on your hands. That is called an attunement. And for a couple of years after I got attuned in 1996, I'm like, now what is the deal with these symbols? To me, what happens is that these symbols have energy. I don't know if you've read the book, The Secret by Rhonda Byrne. It sold about 50 million copies, was on the New York Times bestseller list. The Secret talks about thought having energy. Thought has energy. And so with these symbols, if millions and millions of people are using these same symbols, it jumpstarts the healing process. And it also jumpstarts your ability to learn Reiki, because you can learn Reiki in one day, which seems extraordinary, but you can. Allow yourself to trust your intuition. Now, normally we think, okay, we'll put our scientific hats on and we'll figure out what's the matter with the client, and then we'll try to help them get better. But with Reiki, you want to trust your gut, you trust your heart, you trust your intuition. And that facilitates that healing process. Also, the use of music when you're doing Reiki works great. Whether you use your phone or you have a little speaker or whatever, music is a very nice way to help the person calm their mind. Although Reiki is known for facilitating calmness, it's really quite something. So when you're using Reiki with palliative care and hospice being defined as 6 months or less, the first thing you want to do is scan the person's body, scan the client's body with your mind or your hands. And you think, well, how do I do that? Well, first of all, take a couple of deep breaths and calm yourself and trust yourself. And then a lot of times you might just put your hands and very slowly go over a scan. And what you're looking for is a difference in energy, because the idea is that we want our body to be similar energetically. You may feel a little bit of more vibration or hot or cold or nothing. And so the idea is that we try to equalize the energy in a person's body. In the beginning of a session, it works great to provide Reiki. First, of course, you're getting their permission. Then you're asking for their highest good. And then you say, is it all right if we do a little bit of Reiki to start the session? And you can do that with hands-on, placing your hands on the person's body, particularly palliative care or hospice. It provides them with a calm atmosphere. It helps them be organized for the session. It reduces the stress. During the session, say you're doing mobilization, you're walking with the client or helping them even breathe a little bit more or helping them write, whatever it is, if you place your hands gently on the client, wherever you feel bound to place your hands, shoulders often a very easy place. It's very normal. It doesn't impact a person's mind thinking, oh my gosh, what's happening? Shoulders are very safe, but you can just place your healing hand on their hand if the person's doing something with their hands, or you place it on their hip or their shoulder or wherever. Or you always ask a person before you touch them, is it all right if I touch you? Is it all right if I touch you? If they say, well, I'd rather you don't, Reiki works fine. You don't have to touch. You can just put your hands 2 to 3 inches or even 1 inch, but usually 2 to 3 inches above their body. And the energy comes. What happens is you ask the universe to send the energy. It goes through you. You're an empty bamboo rod. So you're just sending the energy from the universe. You're asking for that client's highest good. It goes through your body to the client. And so you can either beam that energy or place your hands right on the client. At the end of the session, it's always very nice with intention and mindfulness to, again, place your hands very gently. And I'm talking about like just if you can rub your finger right on top of your hand very lightly so that you're really touching the heya of your hand. That's how light this is, because you're just sending that energy. You can do it as a closure just to help the client feel better about themselves. Always ask the client how they're feeling. How are you doing? How are you feeling? Please put everything in a positive manner. There's no need to say, well, I realize that you didn't have any energy in your solar plexus or whatever. We don't say that. We say, I found myself giving you a little bit more energy in your solar plexus, which is located a couple inches above your belly button, and it's the energy center of your body. And so, you put things in a very nice manner so that the client feels good. One of the coolest things about doing palliative care and hospice and end-of-life care is that you can ask the client and or the family, if the family happens to be there, ask them to send their energy to the client while you're doing it. It's a beautiful way to involve the client. And we talked a little bit about the attunement process. When you're in, there's 3 primary levels of Reiki. Reiki level 1, you get attuned. Reiki level 2, you learn why the attunement works, how and why, and what the symbols are, etc. And then there's Reiki master. But all you really need is Reiki 1, totally fine. You can do Reiki with 1. But if your mind understands it, it helps. And that's Reiki 1 and 2. When you do Reiki 2, you learn the symbols so you can attune. You can place the symbols in the client's on the client's hands. So every time they touch each other, touch themselves, They can send healing energy. You can place the symbols on in a family member's aura or on their hands as well. And so it's very, very nice. If you're not ready to attune somebody, meaning remembering what the symbols are and such, just ask them for their own energy, because we all have energy. Would you like to place your hands on your father's body while I'm doing Reiki, or however you want to say it? And it works very, very nice, because what Reiki does is it reduces the pain. That's the number one thing Reiki does: reduces pain, whether it's emotional or physical. It reduces stress. It facilitates calmness. When I have done Reiki with clients at the end of life care, I'd say 95% are asleep within 2 minutes, and it's a very calm, relaxed sleep. It helps people have feelings of self-worth. It helps a little bit with mobilization, engagement, and well-being. And Reiki releases energy blocks. So it really is quite profound. There's a couple of things with end-of-life care, and we define end-of-life care as a person is expected to have 3 to 7 days until they pass. And I worked for a number of years in an end-of-life care unit, and it really was quite an honor to be with people that were passing. One of the first things I learned is that when you're working end of life care, so I'm talking this person is medically diagnosed to pass within the next 3 to 7 days, you do not want to activate the energy below their belly button. You don't want to do that, because that's the grounding. If a person's getting ready to pass, you don't want to help them stay here. If they're really getting ready to pass, you want to help them release. You want to help them move on to their next component of life, whatever that may be. So you do not want to physically touch, and you do not want to provide energy to the lower extremity. What you do is you provide an opening up by your crown, because the crown is the connection to all, connection to oneness. And so in Reiki level 2, you do like this, actually. Instead of Reiki 1 as a beam, Reiki level 2, you're doing a clearing. So we're clearing the crown energy so that there can be a clear connection when they pass. Heart energy is the last to dissipate most of the time. It's really quite interesting with Reiki, because the more you do it, the better you get. You can quickly, whether you do it with your hands or you just do it with your intention, your eyes can be open, the eyes can be closed. You can scan a body very, very rapidly. You will be able to feel where the energy is still in a person's body. When you do not feel any energy in the heart, usually it means, and I mean no energy, usually it means a person's going to pass within 45 to 60 minutes. It's really quite extraordinary. Again, touch is physical. You can beam energy and clear energy, but you don't really want to touch in the last couple of days of life. After you finish with someone that's passing, end of life care, it's always good to ground yourself. And by that, I mean, there's a variety of ways to ground yourself, but you want to, if you're in a unit, you want to ideally go outside, press your hands to the earth, and ask for any type of excess energy, any type of spiritual energy, any type of energy that doesn't belong to you, to go back into Mother Earth or to stay in the unit. You don't want to take home any type of energy that is not needed. And just know that Reiki is known as unconditional love. You know, if you ask any hospice end-of-life care nurse this question, it is quite an interesting answer that you'll receive. And I'm talking any hospice end-of-life care nurse. If you ask them, have you ever seen any of your patients talk to loved ones that have already passed on, or say that they've seen loved ones that have already passed on, or said that they took a little trip and they saw their mother who had passed on, or their grandmother, or whatever? I would say probably 100%, maybe 98% of Reiki, of nurses that are working in hospice end of life care will say yes. Yes, that happens. And so you think, well, now, wait a minute. And what happens when we pass? And I've been fascinated with this concept. What happens with Reiki is Reiki raises our energetic vibration, and it does put us in contact easier with people and entities that are in another realm, that are not in our physical existence. The rationale for this, the medical rationale for this concept, is called a near-death experience. A near-death experience has been declared a medical event by Johns Hopkins. Johns Hopkins University Press published a whole journal on near-death experiences just a couple of years ago. And a near-death experience, if you're not familiar with that term, it's when a person's body is flatlined. So they're dead, physically dead, but their consciousness remains, and their consciousness travels to another realm. 80% of the time, statistically significant, 80% of the time, people that have had a near-death experience see deceased loved ones. Sort of an interesting concept. So you think, well, maybe I might be a little interested in this. The International Association for Near-Death Studies, IANDS.org, is celebrating their 50th anniversary in 2025. They have humongous amounts of research and validation that near-death experiences are real, and they're very similar. They have a free medical information document and a video, and here's the reference for it. It's called Closing the Gap in Medical Care for Near-Death Experiencers. It's free for medical practitioners, and there's the link for that. And you can also get the link for a video. The NDE Research Foundation, NDERF, has over 5,000 reports of people that have had near-death experiences, and the similarities are incredible. In 2021, a man by the name of Robert Bigelow, he said, I will pay $1 million for anyone that can prove the afterlife is real. And so we got thousands and thousands and thousands of submissions, and he formed I think it was a 6-person, very sophisticated medical scientific group of people to evaluate these thousands of essays that were being submitted. They asked 220 people to submit standardized essays validating that the afterlife was real. And what Robert Bigelow said is, I'll pay $1 million to someone that can prove it's real. In November 2021, Robert Bigelow awarded $1.8 million to 29 prize-winning essays, and they are quite fascinating to read. And so you can search, if you search Bigelow Essay Contest winners, if you're interested in receiving the validation that the afterlife is real. A wonderful resource, a very professional association, is called the International Association of Reiki Professionals, IARP.org. They have lots of clinical and medical guidelines for us, for OTs, for PTs, for nurses, for medical physicians, for pretty much all the whole medical practice realm. It's a good, nice, nonprofit organization. They also have liability insurance for Reiki. As OTs and PTs, we do not need separate liability because it's complementary modalities, including Reiki, are part of our practice arena. But if you wanted to get extra liability, they have that. They have a marvelous code of ethics. I use it all the time, and a vast library of information. A couple of days ago, I actually met in person with Bryn Mawr Hospital. And they have an unbelievable Reiki program, and they do integrative health services for palliative care and inpatient hospice, and essentially anybody that would like Reiki that goes to their hospital. Bryn Mawr Hospital is in Pennsylvania, and I knew that they did Reiki because I am aware of what hospitals, particularly in the area, are doing Reiki. This year, Bryn Mawr Hospital, Bryn Mawr, Pennsylvania, trained 230 Reiki nurses this year. They have 190 that are active between the 5 hospital. They're part of the mainline health system, and there are 5 hospitals within it. But can you imagine a hospital training 230 nurses? They're all employees. They receive the same hourly shift, hourly payment as a nurse when they do Reiki. So they have their own standalone Reiki shifts. They provide an average of 30 minutes one-to-one Reiki sessions, and they have 2 beautiful what they call oasis rooms in each one of the 5 hospitals, where you can go for Reiki, or the Reiki nurse comes right into the client's room, which is absolutely fantastic. Ann Blaney is the person in charge. She's certified in pain. She's fantastic. And she's the clinical coordinator of integrative therapies. And her email and phone number is below. So if you're thinking of expanding or providing Reiki in a hospital, this is the woman to talk with. I've been delighted to be teaching Reiki at the American OT Association annual conference since 2015. And this is in 2025. This is going to be the last time I teach it. I'm just moving on to other things. And so you can learn Reiki. You don't have to be an OT to attend. I teach to OTs, PTs, physicians, psychologists, social work, speech therapists, and we have a fair amount of research that goes through. The trick on learning Reiki is you always want to have experiential sessions. You always want that. And so I have 3 experiential sessions, one-on-one. First, you learn self-Reiki, and then you have partners, 3 different partners you receive and share and such. So anyway, it's the AOTA conference is in Philadelphia. It's on Wednesday, April 2nd, and the Reiki 1 is 12 to 6:30, and Reiki 2 is the very next day on April 3rd. If you are already a Reiki practitioner, maybe you're Reiki 2 and you're thinking of being a Reiki master, I'm going to be teaching my final Reiki master course, and it's online and it works online. It's quite interesting. So I'm teaching my final Reiki master training on Saturday, March 15th, 12 to 7 Eastern time. You have to, for me, you have to have 6 months experience after you've received your Reiki level 2 and a one-to-one interview with myself. And so you've got the Austill-Clausen.com Reiki immersion website. So this is my final slide, and I'm very excited to answer any questions, and let's chat. We are all here on earth to grow, to learn, and to love, because Reiki works if you allow it to be. Trust yourself, believe in yourself, and open your heart to Reiki. Let the energy of Reiki flow and lead you with love. So let me stop sharing, and I'm ready to answer any questions. And I hope that was good for you. And it's very, very nice to see so many people.
Becky, thank you so much. I feel your energy through this Zoom meeting, which is incredible. So we really appreciate you, and we appreciate all of the tools that we can put in our toolbox to help our clients, right? There are some questions. I know one of them was very simple, was asking if you knew of hospitals in Boston that are offering this.
Oh yeah,
so that was one.
I tried to get the recent stat on this and I couldn't get it, but in 2017, 42% of the hospitals across the country, this is done by an American Hospital Association survey of all the hospitals across the country, 42% in 2017 offered complementary modalities. Reiki's in the top 3. So the trick on it is to ask. That's what you do. You call up and you say, do you have Reiki?
And I'm pretty sure Dana-Farber in Boston, because I know it was offered to my brother when he was there. So I know they do it, but I thought.
Mass General definitely does. Yeah. Libby Barnett was the original Reiki master. She taught at Mass General. She taught at Yale, Harvard, Dartmouth, and she was. And I'm saying she taught Reiki. So Mass General. But yes, they essentially. I'd be surprised if they didn't have it.
Awesome. Another question from Anne says, what are your thoughts about doing a little bit of Reiki after a person passes? You can't ask their permission directly, but I did it once and I felt so connected to the person's spirit. I sent gratitude to the person's body for being the vessel of a beautiful soul. Also, what about doing Reiki on someone who is actively dying, because you can't ask permission? So,
well, first of all, I think it's a great idea. Great idea. you can ask permission. And I wanted to make sure I stayed to 30 minutes. And so I was hoping someone would ask this question. So thank you very much. The way you ask permission, if the person is in a coma, or they're actively dying and not responsive, or they're in another part of the country, or whatever, the way you do it is first connect with yourself. Take a couple of deep breaths, ideally close your eyes. We're so visually bound. I find if we close our eyes, it helps us with intention. Close. So ideally, I always say, whatever I recommend. If you don't like it, do whatever you want. So you want to do whatever you want to do. My recommendation is close your eyes, take a couple of deep breaths. And then think about the person that you're not able to physically ask. And what you do is you ask them a question and you think it in your mind. Is it all right if I provide you with Reiki? If you receive no answer, that's fine. If you receive yes, that's fine. If you receive a no, and you will receive a no if it's not right, and you're asking with very mindful intention. If you receive a no, then you don't do it, but you always ask. And so, yes, sending it after a person passes, I'm thrilled that you were able to do that, and they will receive it. And you can do it when a person is actively passing, just you don't want to touch them. That helps ground them. We want to facilitate that passage.
Awesome. The next question is, what does an example note look like? What code would you use?
Biofield I'm sorry, I don't know the exact codes these days, but it's biofield energy modality is how I recommend doing it. And there's a wonderful occupational therapist. Her name is Emmy Vadnais, Vadnais, and she has a documentation video. It's 20 minutes and it's free and it's good. And she gives you all the different, she doesn't give the codes, but she gives you all the different words that you can do and use and all of that. But I recommend when you're doing Reiki as part of your OT-PT 30-minute session, if it's 30 minutes. Sometimes in hospice, we're not necessarily limited to 30 minutes, but if you've got a 30-minute session, I recommend doing complementary modalities, 25 to 30% of that session max. So that's about 7 minutes. You don't even have to do it. You can do Reiki just for 1 minute or 2 minutes or whatever. And then I recommend just using the word Reiki once, because it's still being thrown out a little bit by insurance and such, but the response has been incredible lately, particularly the last couple of years, where it is now considered much more acceptable. But my encouragement is to use words like biofield energy modality, etc., rather than the word Reiki. Use the word Reiki once and use it as part of your whole plan for PT or for OT or speech or whatever. But don't concentrate on the Reiki, just concentrate on the concept. And you can ideally say, yesterday when I work with Mrs. Jones, on a scale of 1 to 10, her pain level was 6. Today, when I was working with Mrs. Jones, we provided a biofield energy modality, including Reiki, and we provided the biofield energy modality at the beginning of the session and at the end of the session. Her pain level upon asking her at the end of the session was 3. And so you give it ideally before, during session, and something very objective. And if it gets thrown out, if they say no, just appeal it, and most likely you're going to win.
Awesome. I do that with mindfulness-based interventions, and I'll say the same thing with pain, and I'll say in preparation for ADLs.
Yes.
If that makes sense, right?
Yes.
A good question here from one of my students, hey, Rebecca. How do you deal with the skepticism about the practice from family members or loved ones? She says, I imagine that since the process is not traditional in Western society, that there may be some resistance.
Yep, there is. And personally, I mean, I have it within my own family, and I just don't force the issue, but I do bring interesting concepts to them and just sort of share the results of using Reiki with this person or whatever. And then I say, so what do you think about that? And most of the time, well, that's interesting. But you try not to force the issue. And quite frankly, it has become so much more accepted in the last 3 to 5 years. It's really very, very exciting. Like it used to be yoga was considered far out, and now yoga is very normal. And so I'm looking forward to that happening with Reiki.
And how are Reiki and acupuncture at all connected? Does Reiki follow TCM theory or practices at all?
TCM. What's TCM?
Katie, can you help us? Unmute.
Yeah, sorry, traditional Chinese medicine.
Oh, yeah. Sorry. Sorry. Well, Reiki is energy. Acupuncture or acupressure is using energy. A lot of times what is being used is what's called meridians. And so meridians remind me of the nervous system. It's energy channels that go throughout the body. And so with acupuncture, acupressure, a lot of times you start it at the feet, they follow meridians, you can reduce pain. Reiki is either hands-on or hands-off, very, very, very gentle. And so they both have the same end result of reducing pain. Acupuncture, acupressure is a little bit more physical, and Reiki is a bit more energetic.
Awesome. Do you run into families or patients who refuse Reiki because they feel it goes against their religion?
Oh, good question. And I'm sorry to say, good question, but it is a good question. It drives me nuts, but this is correct. And let's see, in 2008, might be 2009, no, 2009, the United States Congress of Bishops, so the United States Congress of Bishops has said that it is not appropriate for Reiki to be used in Catholic institutions, which is very sad. And the person that told me that was when I was working in the end-of-life hospice inpatient unit, and it was a nun who came to me every week for Reiki. And she says, Becky, do you know the United States Congress of Bishops says that people are not supposed to use Reiki in a Catholic institution? And I said, well, no, I didn't know that. And every year I check and it's still in there and it's still current. And to me, I mean, this is my interpretation. There's a very nice rebuttal that's done by William Rand, which when I teach Reiki, I include it, but it's William Rand's the person in charge of the International Center for Reiki Training. There's also an excellent rebuttal by the American Holistic Nurses. And what they say is that it's up to the individual to decide what is appropriate rather than a religious institution. That's sort of the concept. But if you're ever trying to use Reiki in a Catholic institution, know that you may have some pushback. And, that's just sort of how it is. It's not up to us to change the rule, but it is up to us to understand it. And so that's a scoop on that.
I'm going to pretend I didn't hear that working at Georgetown. Okay. I am unsure how you do Reiki when you aren't on site. It seems I would want the touch.
Yeah, it is
Really?
quite interesting. So I teach Reiki at national conferences, state conferences, and universities. So then we had COVID, and I'm like, well, that's interesting. My entire practice now is gone. And I had on my website that I did online Reiki, and I had done it a couple of times, but it definitely was not my preferred method. And anyway, we're in COVID. And so a lady emails me. I'd never met her before. She was 63 years old. And she says, so I would like to sign up for a 1 hour online Reiki session. And I take a little deep breath and I'm like, okay. And so the way I do it, and you can do it any way you want, but this does seem to work, is I have them place their screen so that I can see their top half of their body. Now, quite frankly, my eyes are closed, but it does allow the person receiving Reiki to know that I'm there and I am sending them Reiki. And then what happens is you beam it. So you beam it. And an interesting thing that happened for me with online Reiki is that now I can see auras. I couldn't see auras before, but now I can see auras. So anyway, I'm sending this. It was an hour session. 20 minutes in, I'm beaming Reiki, and it felt like she had a pain in her right knee, because you can feel it, like you can actually feel this energy. And so I always have yellow pads, and so I write down on my yellow pad, right knee pain. And about 5 minutes later, she was receiving it. It went away. 5 minutes later, it goes away. And then about 5 more minutes, she was receiving it so well, it felt like she was levitating above the bed, which was interesting. And so I write down levitating above the bed. So we finish the session like 50 minutes. And then I say, how are you feeling? This is the first full Reiki online session that I had. How are you feeling? She goes, I didn't tell you when I started that I had a pain in my right knee, but it's now gone. And so I hold up my yellow pad where it says right knee pain. And I said, yes, I felt that. How are you feeling emotionally? She goes, my gosh, it felt like I was dancing on air. And I hold this up again and it said levitating above the bed. So it really is quite fascinating. It's really quite something.
Wow, that's powerful. Somebody, let's see, did I hear you say that Reiki could be 7 minutes and you can do it at one session, do a one session? Yeah.
That's my recommendation.
Mhm.
You can do Reiki in really 2 minutes. You can do it less than that, but the where the 7 minutes came from is my recommendation, because we are therapists. For those of you that are OTs and PTs, 30-minute session, we want to do the therapy. And so it complements our traditional practice. And so I recommend 25% or 30% max doing a complementary modality. And so if you go 7 minutes, 7 times 4, that's 28. So, it's about 30, it's about 25% there, but it definitely can be done less. And so you don't have to do it all at one time. You could do a couple of minutes prepare, a couple of minutes during, a couple of minutes at the end, or you could do it all at one time. But it's very flexible, and you don't have to, look at your clock. You'll get an awareness, and the more you do, the faster it is received. Like it works, and it's the client's own body. The client is pulling the Reiki energy. We're not pushing it in. The client is pulling that Reiki energy that they're receiving from the universe through us. It goes through us to them.
All right, let me see where I am. Thank you so much for your willingness to take all these questions. For those
they're
OTs,
great.
Yeah, for those OTs out there, I just put a survey from a student that may or may not have time to speak at the end. Let me see if I've gotten my questions here. Somebody said they work with their chiropractor together, and that works. Thank you for your response. If anybody else has any questions, feel free to unmute or raise your hand, but I think I've got them all in here. If I missed you, holler.
They were excellent questions.
I have
Rehabilitation.
Question.
Go ahead, Mandy, sorry.
That's okay. I really appreciate hearing this. I'm a current OTD student, and prior to coming to school, I was a Reiki practitioner, and it was a sad moment to feel like I maybe had to leave that behind. So this is giving me a lot of hope and inspiration. So thank you for doing what you do. I was trained to administer like a full session, like the full body scan, going through like every single part of the body. I've done like, especially self Reiki. I've broken out of that mold, but can you just talk a little bit more about when you're doing these truncated sessions, like 5 to 7 minutes, like, are you still doing the scan? Are you just doing it quickly? Are you just going to one area? Like, I'm sure that will grow in time with like intuition and trust, but how do you approach those really quick experiences?
Good question. And I am thrilled to say that as OTs, we have had complementary health approaches and integrative health as part of our OT practice since 2005. And the person that wrote the current Commission on Practice document actually is here, and it's Michelle Bradshaw, and I don't see her name at the moment, but she is here. And so you can just search Commission on Practice, complementary standards of practice in the AOTA website, and you can find it. So just to let you know, it is part of it. You're used to doing it for an hour, which is a traditional session, but train yourself to scan rapidly. I'm sure you scan actually fairly rapidly anyway. So you're going to scan and then trust your intuition on where to place your hands or where to send that energy, and then do it. And when you're doing it for like just a couple of minutes, you can feel the difference. You're concentrating not necessarily on the whole body, you're concentrating on where your intuition is leading you. And then ask the client, how are you doing? How are you feeling? How was that? And almost always they're going to say, you put your hands on my hip and I just had a hip replacement, and it validates it. And you'll get so that you can do it much faster. When I teach it, we do 7 minutes to start with, and then we do 5 minutes. And so you get used to just a quick Reiki session. And some people haven't had the full hour-long session. It's lovely to have the full hour-long session, but you don't have to do that.
Joey is asking, have you seen this being used with OTs in other settings and populations? So I guess non-palliative care, maybe pain management or.
Yep, absolutely. This whole thing was on palliative care and hospice, but yes, and home health, primo, like it works great. Yes, it works great. And well, you've got the Joint Commission now saying that you have to have some type of complementary modality practice, a non-pharmacological practice, in order to be a Joint Commission accredited hospital. So yes, it goes all over.
And Michelle, somebody had their hand up? Where'd it go?
Yeah, it was me.
Okay.
Oh, this is our person. This is Michelle, who wrote our complementary health approaches and integrative health. And she doesn't like me to publicize that because she's very lovely and doesn't like the whole PR. But that's Michelle. We all need to cheer.
Thank you.
Sorry, Michelle.
Thank you, Becky. I was curious. Oh my gosh. That's why I'm wearing red so my face can match. No. I'm curious. I hear you say that we can perceive chakras and things like that. I'm curious for the folks that maybe are questioning whether they can, or like how long does it take to maybe develop that, or like what could you say for the folks that might not be so confident in their assessment of, say, the energy?
Great question, per usual. You practice. The more you practice, the better it gets. Like it's really very interesting. When I teach Reiki, I do 3 one-on-one sessions. People have, 3 different partners, one-on-one. First one's always a little tricky. Second one, they start to get it. By the third 5-minute session, they can feel energy, and they can feel when there's more energy or less energy. And it really is quite something. The trick is to practice, and you can practice on yourself, but it's harder. It's harder to do it on ourselves. It's harder to do it on our loved ones. But if you get your friends or even your animals or whatever, and you just practice scanning and then sending, you can feel when the chakras are aligned or not aligned, when they need a little bit more energy. It doesn't take very long at all. Now, it did take me for the auras to be able to see auras, which is sort of like a related component of Reiki. Well, I've been doing it 28 years. So it took me about 23 years to be able to see auras. So some of these things, it takes a while. But as far as being able to feel the chakras and the energy, that happens pretty rapidly with practice. Happens pretty rapidly. Good question, Michelle.
I think we just have a lot of thank yous in the chat. Somebody says they use Reiki in private practice that specializes in pain and telehealth primarily. So there you go, to answer your question. Michelle, I think I got to you. I will, I don't know, Noreen, does your student want to put a quick plug in for her? Is Christina here still?
She is, and I think she does want to put in a quick
That would be awesome. Thank you for a second, Becky. Before we thank you fully,
of course,
we'll let Christina. Did I lose her?
Hear me okay?
Oh,
Yep.
We can. Thanks.
Hi, I'm Christina. I'm an OTD student right now at Quinnipiac, so working with Noreen. And I'm completing research on the use of complementary approaches, intervention, so OT-based in end-of-life care. So one of the things we are looking at is Reiki, but we're looking kind of at the whole complementary approaches. So yoga, Tai Chi, anything else. There's a whole survey. So I would really love it if you guys could participate so we can get some good data. And that's it. Thank you so much.
I put the survey in the chat. I did it earlier, but we did it again. Well, with that note, I'm happy to stay here, and I think Becky and Noreen are too, but we would like to just really thank Becky for your time, for your energy, and just for helping us just sort of, be broad thinkers in this space so that we can help our clients in whatever ways that we can, right? Just to use our whole mind, body, and spirit. And so we just thank you so much. And Chris and I from the American Palliative Rehabilitation Alliance are very excited to just continue to host interprofessional efforts. Thanks, everyone, and happy Thanksgiving.
Happy Thanksgiving. And Christina, feel free to send me that survey direct to my email, and I'll be glad to do that.
All right, we'll do.
If you don't
Thank
mind.
you.
Hey,
Yep.
thanks everybody for being here. That was a blast. And thank you
Thank
for your
you.
interest in complementary modalities. Thank you for being totally awesome.
Yeah.
Thank you for being open to using your heart and trusting yourself, because you are the most important person out there. It's great. So thank you for being a wonderful, wonderful member of OT, PT, APRA, whatever it is, Rehabilitation Alliance. We are great. And so thank you all very, very much.
And our clients feel that energy. They really do. I mean, in every way, right? I tell people I bring my pom-poms.
Thank you, Anne, very much for doing this, and Chris and
Oh,
Noreen and
thank you.
Laurie and everybody that set it up. It's awesome.
Anybody has any questions, feel free to jump in. If in the end, I think most people are just saying thank you, thank you, thank you in the chat. You're getting a lot of thank yous.
Oh, great.
Thank you, everyone. Thank you. I'm getting smiley faces. Hey, Julie, good to see you.
Thank you, Becky. Thank you,
Yes.
everybody.
Thank you. It was just wonderful. My gosh. Happy Thanksgiving, everybody.
Yes, it is a good time
Truly
to be
happy Thanksgiving.
thankful time. All right. I'm just going to stay here, Chris. I don't know if you want to stop the recording, Chris,
Yep, I'll stop the recording.
and
Thank
feel free
you.
to